Recurrent pregnancy loss is when a couple experiences pregnancy loss multiple times, typically 2 to 3 times. And while pregnancy loss itself is relatively common, having it occur repeatedly is a lot less common and is something that deserves a workup from a fertility specialist. So there are several causes that we can explore, including immune causes, structural causes to the uterus, like medical causes, things that we can investigate. A lot of times we don't find anything and there's not an obvious reason why it's occurring, but I think having that discussion and having that workup is really important. A lot of the tests are blood tests, so we would check for things like thyroid disease, diabetes. We would check for some acquired diseases like antiphospholipid syndrome. Typically we would do imaging to look at the uterus to make sure there's not a septum or things like that. So treatment options for recurrent pregnancy loss really vary depending on the situation. Sometimes it's doing nothing and waiting. Sometimes it's adding a fertility medication or even perhaps doing IVF. Sometimes it requires a simple surgery. It really just depends on the individual situation. Recurrent pregnancy loss is a very frustrating diagnosis, especially because a lot of the time we don't find out why exactly it's happening. The reassuring thing is that a lot of couples, most of the couples that have recurrent pregnancy loss will go on to have a live birth. It's just important to have that workup so that if there is a treatment option available to expedite that, we're able to address the problem.